I'm a community health scientist, and I've been looking at the issue of dementia and Alzheimer's disease more at the population level from epidemiological perspective. So in a project, for example, I looked at dementia risk factors among Manitobans in general. More recently, I've been focusing on population with developmental disabilities, population with intellectual and developmental disabilities, and what is the risk of developing dementia and Alzheimer's disease among this population compared to population without these conditions. So for example, for one of our recent studies, I used data from Manitoba Center for Health Policy. This was using the health administrative data linked with some data from family services, and we looked at the diagnostic codes for dementia for persons with developmental disabilities age 20 and older, and we compared the risk of dementia between people with developmental disability compared to those without developmental disability. We matched people with developmental disability with those without developmental disability based on their age, sex, and also place of residence, just to make our comparison more fair and more powerful, making sure that the differences that we see, they are not as a result of differences in age or sex or where people live and maybe their access to services. So what we found was a significant increase in risk of dementia for persons with developmental disability compared to the matched comparison group. So talking about the age group 20 to 54, people with developmental disability were 4 times more likely than people without developmental disability to have a diagnostic code for dementia in their medical records. And for the older age group 55 plus, people with developmental disability had almost 5 times more likely to have a diagnostic code for dementia in their medical records compared to the other group, people who didn't have developmental disability. I believe the increased risk based on what we have found is very alarming. It tells us that this population will benefit from regular screening and assessments for dementia. We know from other studies that the symptoms and signs of dementia is different in this population. So just educating the caregivers, clinicians, that's a very important point. And I believe this was a very quick look at what's going on using the administrative databases that we have. Although it's a great data, but there is lots of limitations, so we needed to start collecting data and looking at all sorts of data that is available, at least here in this province, to find out more about what's going on, and for example, at what age these individuals get the diagnosis, what happens after they've been diagnosed, which services they've been accessing, and how that impacts, for example, utilization of physician services or hospitalizations, what happens to individuals in terms of their functional ability, any changes in their living arrangements, and so on. So there's lots to explore, and this was just the first step, and I very much hope that with more funding to research on persons with developmental disabilities, doing more population-based type research, we will be in a better position to understand more and to be able to support this population.